And thank you everyone for being here. We're actually right back on time again, which is fantastic. Well done. So thanks Deirdre and the panel, and for everyone who's here today that's contributing to this conversation. My name is Judy Lothian and I'm the Head of Research at Bolton Clarke. And part of my role is to focus on the work that we do with the whole business, a number of external collaborators, as well as our community members to support the implementation of evidence into practice. I'm thrilled to chair this final session about how to make social connection activities into business as usual. We have 3 representatives from organisations in Australia and the United Kingdom today, and they're all working to enable social connection. Each speaker is going to give an overview of their organisation's activities, and this will be followed by a panel discussion again, so please use the chat to post questions so we can bring them into the conversation. Our panel members are Associate Professor Michelle Lim, Dr. Daniel Feinberg and Dr. Bogdan Chiva-Jurka. Now, Michelle is first and she wears a number of hats. She's a clinical psychologist as well as being an eminent researcher into loneliness and social connection. She's also the Director of Social Health and Wellbeing Laboratory at Swinburne University, where she generates a huge body of evidence for the drivers of loneliness and developing consumer relevant digital interventions to improve social connection. In her spare time, Michelle is also the Scientific Chair of Ending Loneliness Together, an organisation which she created a number of years ago. So Michelle is now going to provide her perspective of what is needed to enable social connection for all Australians. Thank you, Michelle.
Thanks, Judy. Just to acknowledge that I'm the lens of the Wurundjeri people of the Kulin Nation, who are traditional owners here. Thank you for giving me the 5 minutes today to talk about the work that we're doing, and also some of the things that we will be doing at Bolton Clarke. So as Judy mentioned, I'm the Scientific Chair and Chair of Ending Loneliness Together, which is a national organisation that's leading the way to combat loneliness in Australia, and this is across the lifespan. As part of Ending Loneliness Together as well, I am the co-founder of the Global Initiative on Loneliness and Connection, which has recently released some position statements, have written some position statements that will be released shortly. And we've kind of set some definitions on what social connection is. And just to be brief, when we do refer to social connection, it tends to be an umbrella term to actually talk about encompassing less social isolation, less loneliness. The Global Initiative in Loneliness and Connection channels in 10 member countries and are also going to be working with the World Health Organization on the Commission to Social Connection. Now, these definitions will be taken up by the World Health Organization, but also by the EU Commission to the EU Commission Joint Research Centre that's also doing work on loneliness. I want to state that Ending Loneliness Together will be also taking on these definitions in order to be aligned with the World Health Organization Global Initiative in Loneliness Connection. Just in short, we do coin loneliness as a subjective and unpleasant, distressing feeling of connection to other people, along with a desire for more or more satisfying social relationship. And being socially isolated generally means just having objectively fewer social relationships or roles or infrequent social contact. The reason why we have set this is really to ensure that we all use the same terms so that we can actually design, deliver more effective interventions to really target the outcomes that we want. I'm also really pleased to end this very short presentation to announce that Ending Loneliness Together and Bolton Clarke will be going to a partnership and be generating some good work over the next 2 years. I'm very, very pleased to really work with Judy and her team to really ensure that all of us are aligned, but also to ensure that we kind of deliver or design interventions that do make sense for both loneliness and social isolation, and in a way that is engaging and in a way that doesn't further stigmatize the issue, but at the same time engage people in building that meaningful, strong social connection. Thanks, Judy. I'll I'll hand over to the next person.
Thanks very much, Michelle.